Thomas Baldrick here at ASH 2014, joined by Dr. Katja Weisel, who is here to discuss results of the German GMMG-MM5 trial. Thanks for coming.
Thank you for inviting me.
So let's talk about what this trial is and what you've done with it.
Okay, the GMMG-MM5 trial is a multi-center trial for treating primary diagnosed myeloma patients until the age of 70 with the primary high-dose concept. These patients had an induction chemotherapy with a bortezomib-based triplet combination and then underwent stem cell mobilization and high-dose melphalan treatment with autologous stem cell transplantation for 1 or 2 cycles, and after that lenalidomide-based consolidation and maintenance therapy. And in this analysis we did here, we looked on the imaging of the myeloma bone disease with a whole body low-dose computed tomography.
And what are the highlights of what you found?
We are now acknowledging that the whole body low-dose computed tomography is integrated in the revised IMPG criteria, recently published this month in Lancet Oncology, because it much more precisely demonstrates the myeloma bone disease than the conventional X-ray. And what we could show here in the first analysis of the first 44 patients in this trial, were more than 600 patients included, that we saw in all but 5 patients myeloma bone disease, mostly by osteolysis, but also with a diffuse osteopenia. However, the CT scan allows not only showing very precisely the osteolysis, but also it detects the bone plasmacytoma, so the outgrowing myeloma tumor out of the bone, and the bone marrow infiltration. We see the medullary infiltration. For the patient, it's very convenient because it has an acquisition time only of 30 to 40 seconds. There's no radio contrast agent, and it is very well comparable between the centers. What we saw was that in the follow-up of these patients, the vast majority, nearly all patients, well responded and showed a decrease or complete disappearance of the marrow infiltration and of the bone plasmacytomas, and this could be very precisely detected. What was even more striking for us was that 17% of the patients showed a resclerosis of the existing osteolysis, so that a ring was there with a calcification around the osteolysis, so that we see that it's again a stabilization there of the bone. And this has, for our opinion, an impact on the patient's life quality and controlling of bone disease, and so that we could demonstrate for the first time, to our knowledge, that under a bortezomib-based induction, or an induction including the new agents, these rescleroses can occur. Furthermore, we had even one patient where we saw for the first time a decrease in the osteolysis, so that some even disappeared during follow-up. And we will now extend this analysis further to more than 200 patients as the next future project.
Very good. Thanks for sharing your success, and we wish you more in the future.
Thank you very much for inviting me.
Okay.